Greetings, everyone. My name is Radhika Dhawan, and today I'll be taking you through my research article, which is titled Cognitive Processing of Small T Trauma Among Adults. So, a little about myself. I am currently a counseling psychologist based out of New Delhi, and I am associated with this organization, which goes by the name AnamkaaRuh Therapy, Care, and Counseling. And Today I'll be taking you through my study that I completed as part of my dissertation during my master's. So my specialization lies in counseling psychology, trauma-informed care, and crisis intervention. So this research article was completed successfully under my supervisor from Christ University, Bangalore, India, as part of course completion for, of course, as my thesis. This study basically investigates and describes the experiences of adults cognitively processing what we call as small t traumas. So through the use of a trauma screening checklist, which was self-developed, and 10 questions with us as part of the semi-structured interviews, the lived experiences of how adults process and cope with traumatic information in real time were understood. So DSM-4-TR describes trauma as any direct personal experience of an event that involves either an actual or threatened death or serious injury to either one's own integrity or another's integrity. And small d traumas are specifically referred to as ego-threatening distressed individuals that leaves them in a state of considerable helplessness. The types of small t traumas fundamentally include, say, conflict with significant others, loss of a significant relationship, conflict with a supervisor or a boss or a colleague, an abrupt relocation, planning a wedding, starting a new job, having or adopting a child, and so on. Moving on, we see cognitive processing and appraisal. Cognitive processing was a fundamental part of this research as it refers to ways in which people think, perceive, and understand knowledge and information. And this was seen with respect to traumatic situations that they had witnessed or experienced in their lifetime. And cognitive appraisal, an idea which was initially advanced by Richard Lazarus in the 1960s, was defined as a personal interpretation of situations which determines the degree of intensity of an individual's perception. So these two concepts played an important role in seeing how an individual perceives a traumatic situation, if they even perceive it as an intense experience that has brought about considerable change in their life. And with what intensity do they identify it as a traumatic experience, or if at all they identify it as a impactful event that they have experienced in their lifetime, which may have considerably brought about changes in them as a person or their characteristics, and maybe those changes are here to stay. The rationale behind this study basically comes from the fact that there was a dearth of studies on small p traumas for the sole reason that they are trivialized and not recognized as life-altering events in the first place. So they are very common, they're seen as very common, and they occur on a daily basis. So overlooking such experiences is easy due to the tendency to justify the event as normal, and individuals cognitively shame themselves into feeling guilty by suppressing feelings to avoid having their reaction towards the event be perceived, say, as an overreaction. The lack of studies conducted for this topic in the Indian context was another one of the reasons I chose to study this topic. It becomes imperative to find out the perceptive capacity with reference to the environment and culture which is present at a given time and space of the population within a country that may affect how certain small t traumas are even looked at to begin with. The need to study this topic stemmed out from gaps found in research studies with lack of concentration on the processing of trauma in real time. So there were a lot of studies in the review of literature that found out what the outcome was, how individuals cope with it, but how they process it, what they think in the first 6 months the time duration of the first 6 months after they have experienced the trauma, how they feel about it, how they think about it, what thoughts are running in their head while they're trying to make sense of their reality and their surroundings. There was a lack of study material in that particular aspect as well. And factors like individuals' personality, mood, behavior, culture, family dynamics, and socio-demographics and economics were also taken into account in order to study this topic better, of course. Moving on to the method, the aim was to understand how adults cognitively process traumatic events. The research paradigm was interpretivist, which was interpreting the lived experiences of individuals by discussing their events and their life in the interviews that I had prepared with my supervisor while at uni. And the sampling was, of course, purposive. And this study, I would like to bring to the notice of everyone, was conducted right when the pandemic hit. So I was about to begin my data collection stage is when the pandemic hit and uni closed, and my sort of data collection methods and conducting in-person interviews was hampered a little, but thankfully, because of the sample size and the sample age that I had taken, it really helped me to transfer all of the interviews in the virtual world as well and conduct my research in an in-depth manner as much as I could at that point. Tools of data collection. Here we have the trauma screening checklist. So this was a self-developed checklist consisting of large T traumas and small T traumas, and was curated by me based on empirical evidence, and it was validated by my supervisor as well. The next was, of course, semi-structured interviews, and they were used because of the flexibility that is there around semi-structured interviews, where you have a basic structure, but according to how your interview is going, you can manage to put in extra questions. And because of that flexibility and the ability to get rich, in-depth information is one of the major reasons I took up semi-structured interviews. So before we move on to how the interview schedule was drafted, I would just like to bring to the notice of everyone that the age group that I had taken was between 18 years to 45 years. And the trauma, and this was because why initially I moved from young adulthood to adults in general was because some of the traumas that I spoke about earlier in terms of, say, infidelity or divorce for that matter, because of the average age of people in India getting married has moved from, say, 23, 24 to good 30, 35. Some of the traumas that are experienced post, some of the traumas that are experienced, such as going through a divorce, planning a wedding, abrupt relocation, or maybe moving to a new city for work, they come at a much later age, which is why, and these traumas or events are best suited to people who are at least 25 years of age or above, according to the stats and research that was found within the Indian context. And here the inclusion criteria that we had taken was that the participant must have experienced at least one small T trauma, and they should have experienced that 6 to 8 months before I was speaking to them in the interview, and they should be well versed in English as well. And exclusion criteria was that experiencing any large T trauma, such as a major physical accident that has brought about any physical or psychological disability, or any domestic violence cases, any large T trauma experienced in a lifetime was one of the exclusion criteria, and also any current to previous diagnosis of psychiatric or neurological disorders was also one of the exclusion criteria. So I will take you quickly through the development of the interview schedule in the pilot phase. So post the literature review and discussion with my supervisor, the first draft of the interview schedule was formed. And upon feedback, a second draft was formed and a third draft. And in between the third draft and me conducting a pilot study with, say, administering the semi-structured interviews onto 2 participants, There was also expert evaluation in the sense of me sharing this interview schedule with some of the other supervisors and members who were on the board to which I had to, the ethics review board and the general board to whom I had to defend my dissertation to. And it was shared with almost close to 4 supervisors, and their feedback was taken. And after their evaluation, it was administered to 2 people. And post the feedback on the 2 interviews conducted to map the time, how the conversation goes, if the language needs any more um, modification in the sense where maybe my message is not communicated well enough in the questions I've asked. Only then was a final draft prepared. Moving on to the method of data analysis, thematic analysis was chosen as means of analyzing the data, and it basically includes identification of themes, which is the patterns in the collected data that are of interest and importance, and address issues brought up in research. With the use of interpretation, the life experiences of the participants were analyzed, coded, and grouped together in order to establish similar patterns of processing and coping. And one of the top reasons this method was used was because of the flexibility that it entails. What I mean by this is that this characteristic really allowed modification for collection and analysis of a large amount of complex data, because the interviews lasted for over good 1.5 hours. So really rich data that can be, and complex data that can be coded into themes and codes in a very structured and organized manner. The ethical considerations taken care of were of confidentiality and privacy utmost, and beneficence and non-maleficence. Here, with confidentiality and privacy, the voluntary nature of the research study was communicated to the participants, and with beneficence and non-maleficence, the major reason this was taken into high notice was because of the vulnerable population that I would have been dealing with, given that I was stepping into this realm of very sensitive trauma concerning conversations. So how the language is, how I communicate. And by this time, I had already started practicing individual counseling under the supervision of my university's department, psychology department, with a separate supervisor for my cases. So it really aided me while collecting data and taking these interviews. It aided me in rapport formation as well as handling conversations around traumatic events, because by that time I had started learning my elective in trauma-informed care. So I was basically being trained in trauma-informed care as well as crisis intervention. So it really helped me conduct the interviews in a very holistic manner. So the major findings and the results that came out to be were, the major themes basically included appraisal of the traumatic event. So here, the sub-theme was factors of experience and state of mind. So what we would see here was how stress, confusion, feelings of hurt, and whether the trauma was sudden or gradual, how it affected an individual when they processed the trauma. Majority of the participants did not even accept the situations they had gone through as traumatic experiences in the first place. And they displayed an attitude where they felt like the impact was not so much, and provided rationalizations for the same events as if they were not physically disastrous to them in any manner. So the feelings around trauma, we saw the types of feelings. So this was sort of lack of awareness and acknowledgement among the participants regarding the impact of the situations in their lives that came from looking at the circumstances more as personal stressors that everyone has to go through across in their life. And they were not, in the participants' heads, they were not categorized, as being enough to be able to cause psychological and emotional dysfunction within the participants, which was very interesting to see. And this in turn led to the participants developing maladaptive coping mechanisms of bottling emotions and attempting to manage situations without the help of support systems or otherwise professional help. Appraisal of the consequences of trauma. This included thoughts directed towards oneself, thoughts directed towards others, and thoughts directed towards the world. So here, all the participants mentioned blaming the circumstances on themselves and feeling guilty for the events that transpired with the thought that they were responsible for maybe their partner cheating on them, or rationalizing the stress that came from the abrupt moving of cities or extended relocation or loss of a significant relationship or friendship in their lives. And they mentioned being unable to make sense of their surroundings and the situations for good 3 to 5 months after the incidents had taken place, with some of the participants feeling the effects up to a year or more. Almost all participants experienced a modification in their attitudes, such as reduction in trust, openness or open-mindedness towards new relationships, and definitely their self-confidence and self-esteem had taken a hit. These changes were welcomed in a way that would act as protective factors in the future and prevent any kind of further damage in their head. Sleeplessness, low self-worth, suspicion towards other people's intentions towards themselves, and isolating themselves from social support systems and were some additional factors that came to light during the interviews of how the individuals make sense of the trauma and the surroundings. The next theme that came up was of tangible ways of coping. So here we looked at the different methods of coping. The semi-structured interview included a question around knowing whether or not the participants sought professional help. So due to the variance in perspective while viewing both traumas, individuals fail to recognize their situation as impactful and causing themselves more psychological harm, which is what led them to not take professional help. So majority of the participants mentioned that although they were under severe distress, they felt like they had to be resilient and probably toughen up and just get through this process, and that they should be able to deal with issues that keep happening on a day-to-day basis because, well, everybody goes through it. So supporting this was the attitude of the participants, where a section of them mentioned statements like, oh, like I got lucky, or, because I didn't have it as bad as the next person. So, and explaining their thoughts around processing of the trauma, therefore, again, leading to a process of trivialization. A lot of the participants reported feeling, yeah, the need to feel resilient and toughen up. The family outlook, a lot of participants reported feeling uncomfortable sharing their problems with their family, stating reasons of the family's inability to understand the depth of the emotions that the participants were feeling and the trauma that they had experienced. And often poor family environments tend to be associated with um, less emotional seeking of support, because there is a lack of cognitive processing and restructuring, and of course, an increased chance of conduct and emotional issues. Moving on, we see some of the gender differences that came about were that men were seen as more conflict avoidant, whereas women were more confrontational when it came to conflict resolution. Men had more trouble dealing with emotional problems to the extent that it was extremely upsetting. And an observation that was made while conducting these interviews with men around infidelity and the troublesome circumstances at work was a little more difficult as compared to women. And this was mostly because men show less emotional expressivity, especially for positive emotion. And there is a huge internalization of negative emotions, one of the studies that was done by Chaplin in 2015. Coming to the strengths of the study, definitely one of the major strengths is that it opened an arena of understanding the cognitive processing of individuals in terms of intense situations and traumatic experiences in particular in real time. Definitely opened an area again for the outlook towards understanding what small t trauma is, and just maybe making a difference between what is a normal circumstances and what is a normal circumstance and what is an actual traumatic event. The next is that it created space for psychoeducation on how to understand yourselves better and the situation better, and how you can process it in a manner that does not lead to unhealthy coping mechanisms or mechanisms that would help you just temporarily. The next was, of course, to normalize seeking help and not take it upon oneself to figure out traumatic events in a manner where it's more detrimental to one's psychological health uh, anyway and causes more harm in the situation when they're already in the process of being confused or say being scared or anxious around figuring out what it is that they're actually experiencing or feeling towards an event, situation, or person for that matter. And definitely it adds to the research pool of bridging the gap between large T and small t traumas. Some of the areas of improvement that I felt came up was that, of course, a larger sample size could have been taken because this research was done in over about a year or so. I think the quality of my interviews, even though about 25 of them were conducted, there were 10 that made it into the study because of the kind of in-depth conversation and information that could be taken out from the various interviews. Definitely reduce the gender disparity of participants. I feel if there was an equal number of men and women, then the gender differences could have been easily mapped and it would have been a more accurate representation of the population as well. And definitely, like I'd mentioned before, that this was done in the pandemic and my interviews were not conducted in person. So I think if I would have the chance to do it all over again, I would definitely hold more in-person interviews so that I'm able to record the non-verbal cues in a better manner. And with this, we come to the end of my research study of cognitive processing of small t trauma among adults.